Principal Secretary of Health and Family Welfare Department Sampat Kumar today stated that the government's concerted efforts have led to a significant 50% reduction in the maternal mortality rate over the past 4 years. In 2020, there were 238 maternal deaths, which dropped to 110 in 2023. He emphasized that the Health Department holds regular review meetings to assess maternal deaths, conducting root cause analysis to mobilize targeted actions on the ground. Acknowledging the complexity of reducing MMR, the Principal Secretary noted that detailed analyses are carried out on an almost weekly basis. He also highlighted the Chief Minister's Safe Motherhood scheme, under which resources are being effectively utilized to safeguard maternal health. Furthermore, the state has collaborated with Tamil Nadu government to train 60 doctors in ultrasound techniques, enhancing maternal care capabilities.
As a part of our maternal death review meetings, what we do is that whenever there is any maternal death occurs, actually we started doing this for last 4 years. In fact, we have a detailed review, why it happened, what are the reasons. We actually analyze it in a all systematic way. What are the root causes. We do a lot of root cause analysis and try to mobilize the actions to see that such kind of factors, how they would be addressed, so that in future such kind of deaths would not occur. So we take so basically through that constant iterative process, we in fact take very very concerted action on the ground, and also to see that what kind of a further support can be provided. So it's a very important exercise for us, because every mother who every mother's life is so important. We need to save each mother's life. So with that effort, of course, there is a decline. In fact, we could see there is a decline in terms of the maternal deaths in the state, over 50% reduction in the last 4 years that we could witness. But as a state, in fact, again, one of our strongest desire is that we should reduce it even further. So those are the efforts that we do make. So this is almost like a very long discussion, to understand different factors. Some factors are related to still there is a how to actually overcome those factors, in the sense so it's a very very complex problem. In fact, it is not just it requires a lot of mobilization. But still some cases they in hard to reach areas, things are how to reach out to them. So there is now, based on all these this entire detailed analysis and reviews and constant reviews, we do it almost on a weekly basis. There is a program was designed. In fact, it's a Chief Minister's Safe Motherhood scheme, and through which actually a lot of support is being provided to the medical officers, so that they can use those resources to save mothers. So they can actually, now we are proactively taking the mothers. In fact, this is something that was shared in Purakasya. Purakasya is one of those remotest places in Garo Hills, where the doctor was saying that entire hospital, now she has in a PSC she has 10 beds. All the 10 beds are full with pregnant mothers, and so now we are thinking how to expand those beds, how to expand the support, and every mother now, actually we are trying to get at least one ultrasound scanning, which was not there earlier. So because ultrasound scanning, basically it helps whether the mother has any complications, so that actually we can take preventive measures. So and then we don't have doctors who knows how to do this ultrasound scanning. So what we have tied up with the government of Tamil Nadu, where we already 60 doctors have been trained. And So they go for 6 months, they live there. In fact, we made those arrangements with the government of Tamil Nadu, so they get a lot of practice there. And then they come back and now they are able to manage these things. So it's a lot of health system strengthening work. It cannot be done like built in one day, but it requires a lot of effort from everybody, and we are getting a lot of support from, like everyone actually has a commitment. We have, in fact, our Honorable Chief Minister reviews this program, and our Health Minister reviews the program. So, and we do it on a very, very regular basis. And the districts headed by the deputy commissioners, they have the human development teams. They review the program. So it's a priority for the state to saving. That's like once it has become a priority, we could see that change that what we wanted to see. But as you said, it's a continuous process. We can't actually take any break or anything, because it's a birthing process happens every year. Almost like 80,000 pregnant mothers, deliver babies. So it's a very, very, very careful and work that actually we all need to do. And
so how do you come to a conclusion that the MMR has reduced? What are the indicators?
I know it's like a number. Like suppose like in 2020 there were about it was about there were 238 deaths, and now in 2023 it's about 110. So it's a reduction of that.
Okay. So you had already mentioned that the mothers has really influenced, really helped. So if you can just elaborate briefly on that.
Yeah. So one of the things, of course, like in this work is also that we have been having the data now basically about every pregnant mother. So like for example, today in one of one place they found that like the pregnant mother has the 7 grams hemoglobin. It's a very low. So we have the data now. So now how such mothers would be made sure that like they are taken care of, even if required blood transfusion or iron sucrose. So basically to provide all that, once you have the data, like you will not miss out anything. There is a greater accountability. Without data you will not have accountability. You can actually try to pass the responsibility on something else, but like when you have the data, it's a greater accountability in the system. So that's working. So we have a real-time database. In fact, anyone can see, like we don't get that because of confidentiality we don't give the names, but the numbers are available to anybody to see. It's a meghealth.in.
Right. So talking about data, which are the worst affected areas, sir?
So that's where today's discussion was essentially wherever we have more number of cases, there actually we have had a very in-depth review meeting, like why those cases have happened, like so there are cases like in essentially like Ranikor is one place. I'm just giving an example. Today we had a review with Ranikor. There are 2 maternal deaths they've occurred, and in fact there are a lot of challenges. There is no network. There are so many challenges, like even to inform to the CHC there's a issue of network issues there, and the monsoon season is even difficult in terms of like traveling and all that. So we are putting like we asked the Ranikot CSC, in fact with the help of the deputy commissioner and the BDO, they should set up a transit home there in the Ranikot, so that like you can bring the pregnant mothers. So they're even struggling to get a space there. So there are such kind of hard to reach places where you definitely, when you have such challenges, you also have these challenges of maternal deaths there. So definitely, but like the good news in another place like Bharim, it's a not in Bharim, it's a what is that place? In Amjong sub-center. There is it's again a remote place in Barneyhat, CHC area. So where where again there is one maternal death occurred. So we reviewed like there's again a problem of lot of dropout. We asked about the educational status of that young mother. She's been dropped out of the school. So there's again a correlation between the schooling and all that. Then again there is they are now setting up a transit home in the sub-center area, so that all the hard to reach area places people can come and stay there well in advance, so that there can be a safe delivery can be ensured at the sub-center. So lot of this is called a lot of decentralized action is happening. A lot of people there's a lot of so it's a decentralized leadership we call it like, we are promoting that one, so that like more and more responsibility and full responsibility is taken by everybody to see that like, every mother is saved.
So the antenatal care in most of the districts is, many people are saying that it's not up to the mark, as well as the setting up of PICU and NICU in various districts. So what is the government doing on the department?
Yeah, so that's what, like, antenatal care, that's what I told you. To improve the antenatal care, we require a quality antenatal care. It's not, so that's where at least one antenatal care out of these 4 or 5 antenatal cares that are done should be with ultrasound. So with ultrasound, so basically that's again a provision is being provided. So basically mothers are actually given transport support to take them to our ultrasound facility, get the ultrasound and send them back. This provision has been done under Chief Minister's Safe Motherhood scheme now. So that's been improving, but still, as I said, like, we need to improve it further. As I said, like, we need to train more and more doctors under ultrasound. That process is on. In fact, one more batch is passing out this 16th of November from Chennai. So they are coming back. Another 30 doctors will be joining us. So this work, as I said, like, that's one. And coming back to the PICU, NICU, yes, they are required, and that's where a plan is there. In fact, if you look at Ganesh Das, a new NICU was set up, and so many patients are being referred now. So that process is on. In fact, our idea is to really strengthen almost all the district hospitals with this kind of facilities. Yeah.